Hello everyone, this is Raymond Lee from Raymond's Dental Solutions. Today, I want to take a look at the dental hygiene profession and explore just how great it can be, especially when compared to being a registered nurse. Let's start with the educational side of things. While both careers require solid education, there are some differences. For dental hygienists, the typical degree required is an associate degree, which takes about 2 to 3 years to complete. Admission to this program is usually less competitive, with GPA's ratings from 2.5 to 3.2, though some programs may require a higher GPA. On the other hand, registered nurses generally need either an associate degree (ADN) or a bachelor's degree (BSN). It can take anywhere from 2 to 4 years to complete, depending on the program. The GPA requirements for RN programs are typically a bit higher, ranging from 3.0 to 3.7. And competitive BSN programs can even require a GPA as high as 3.5 to 3.8. Both professions required standardized tests like TEAS or HESI, though for RNs, these are usually a mandatory part of the process. As for clinical hours, dental hygienists generally complete around 600 to 1,000 hours during their schooling, while nurses often have 1,000 to 1,600 hours of clinical training, which also includes residency preparation. Dental hygiene programs tend to have a lower academic threshold, fewer prerequisites, and take less time to complete than nursing programs, making it an appealing option for those looking for a quicker route into healthcare. Now let's talk about patient care and the emotional impact each role can have. Dental hygienists typically work in a scheduled one-on-one setting, providing preventive care and educational guidance to their patients. They see the same patients every 6 months or so, and over time, this builds a strong long-term trust. The hygienist work focuses on oral health, disease prevention, and even linking oral health to systemic conditions like heart disease or diabetes. Registered nurses, in contrast, tend to have more variable patient interactions. They might deal with emergency situations, acute care, or long-term care. The patient relationships can be more episodic, depending on the specific medical unit or rotation, while RNs play a crucial role in disease treatment and recovery. Their connection with patients can be more short-term. When it comes to behavioral influence, hygienists often have a stronger impact. They spend a lot of time teaching patients about hygiene, diet, and healthy habits, while RNs, though important, typically focus more on medication, follow-up care, and patient education. Even though dental hygienists work in a more localized area, oral health, the long-term relationships and preventive education they provide often lead to a deeper, more personal influence on their patients' overall wellness than many RN settings. One of the most attractive things about being a dental hygienist is the work-life balance. Dental hygienists typically enjoy weekdays-only schedules, often with the possibility to work part-time or have flexible hours. There's little to no emergency involvement, and the physical strain is moderate, mainly from repetitive motions and posture. The emotional stress is generally low to moderate, and because of this, burnout rates are lower, around 25 to 30%. Overall, job satisfaction is pretty high, with the most hygienists reporting satisfaction rates between 70 to 85%. On the other hand, registered nurses usually work shift-based schedules, which can include nights, weekends, and holidays. They also experience a lot more emergency involvement, especially in settings like the ICU or ER, which adds a lot of physical and emotional strain. Nurses deal with high emotional stress due to the nature of their work. Trauma, death, and high nurse-patient ratio contribute to burnout rates that can be as high as 40 to 50%. Their job satisfaction is a bit lower, ranging from 60 to 70%. Dental hygienists generally enjoy greater control over their schedule, experience less emotional burnout, and have a better overall work-life balance compared to RNs in most clinical environments. So, while the path to becoming a dental hygienist may be quicker and less academically intense, the impact they have on their patients' long-term health, behavior, and confidence can be remarkably big. Combined with a stable, flexible, and family-friendly work environment, the career offers a fantastic balance between impact and lifestyle. Fewer emergencies, more relationships, real prevention, lasting impact. Thank you so much for watching. Helping your business thrive is my driving force.